Right. Okay, two more people are coming in.
Hey,
Dr.
Doc, if you
Ward.
can make sure someone's paying attention to the chat as well as we go along.
Yes, Stephanie's on. She'll notify me. All right, so Dr. Ward is here. And Chastity Walker. So we had three more come on. Okay. So today's topic, we're going to talk about IV nutritional therapy and why we need IV nutritional therapy. All of us, even with intact gut function, you still need it. So first, let's talk a little bit about toxins. I'm going to tell you what they are and why we need detoxification. And then I'm going to get into the IV nutritional therapy, the glutathione, the Myers, the phosphatidylcholine, and the NAD. Then I will talk about some of the things that boosts our immune system. And then lastly, for coronary artery disease or cardiovascular disease, the nation's #1 killer, we're going to talk about chelation therapy, just briefly. So what are toxins? Yeah, people say, I'm getting a detox. What exactly is that? Well, they're fat soluble. In other words, they live in your fat. That's where they hide out. They live in the fat cells. So when you're losing weight, what sometimes happens is that the toxins can get exposed and then they go into your blood. So it's important. That's why I always start people off with that first week. I try to get them to do the core restore detox. But there are other ways to detox. You can do the 7-day program, the core, or you can use glutathione, which is an IV detoxification. So there are materials that they come from plants, they come from animals, bacteria, viruses, fungus, and other microorganisms. So they could be infectious substances, or they could be molecules that's been man-made and synthesized, such as detergents. And they stay in the body permanently unless you remove them. They are typically not good for the body, and they exert a toxic effect. So when you say you're toxic, you get chronic fatigue, depending on what it is. So here are some of the sources of toxins on the outside of our body, because we actually, as we eat, we produce some toxins as well, but I'll get into that. But the pollution that we breathe from exhaust, car exhaust, from factories, those are toxins. Paints and any cleaning products that you may have in your house that you inhale, they go in your body, right? Heavy metals such as cadmium, mercury, which we know is bad, lead is bad, it causes brain dysfunction. And mercury also messes with the brain, and it messes with a lot of the neurological functions. So pesticides that we put on our food, and herbicides, insecticides, these are all things that we put in our grass or on our food to prevent parasites from eating them. But unless we're washing them properly, part of being organic is that they don't use any of these things. That's truly organic, but many farmers, they use these things, and it's on your food. So if you're not getting organic foods, you got to make sure you're washing your veggies properly and your meats. So ionizing radiation from cell phone and cell towers, they produce toxins. Some of the inhalants from cleaning, even perfumes, some of those, they're toxic. We know nicotine can be a toxicity when you take it in the form of tobacco. Alcohol, too much, in moderation, maybe one, probably not too bad, especially with wine, red wine. But caffeine, if you do it too much, these are all lifestyle things that excessive amount of these is not good for you. And then obviously recreational drugs, prescription drugs, even your high blood pressure medicine or your diabetic drugs, they are toxins and the liver has to get rid of it, right? So the liver is the primary detoxifying organ in the body. And then if you're eating fast foods, yes, and Chick-fil-A, one patient told me, well, Chick-fil-A is a healthy fast food. I don't think there's any healthy fast foods, but yeah. So there is, if it's fast, if it's refined, bleached is another term, devitalized, food with high sugars, artificial food additives, colors, preservatives, meat that contains growth hormone, anabolic steroids, or antibiotics, those are all considered to be toxins. And obviously bacteria and viruses. So what about inside the body? Where do we get that? We have beneficial bacteria in our gut. We shouldn't really have fungus in our gut, but we do, Candida primarily. And if the good bacteria dies out, then the yeast can overgrow and cause inframammary infection on the skin infections. It can cause vaginal infection. It can cause lung infections. And so, yeast is, when it's controlled by the normal flora, it's okay. But if you get stressed out and those die out, then the yeast will take over. Viruses, yeast overgrowth I mentioned, and then the byproducts of our metabolic reaction. If we're eating, we're going to produce ammonia. The kidneys will produce that. Carbon dioxide, we breathe in oxygen, we breathe out CO2. And then obviously when we're a motor, if you look at an engine, you put gas in that engine and what comes out through is exhaust. So for us as humans in our motor, we produce free radicals, oxygenized, highly charged particles that can damage every cell in the body. So we need to take in plenty of good foods to neutralize the free radicals, to reduce the ravishing effects and aging, right? So we talk about antioxidants. That's why they're so important. And then if you're not moving your food along, or you have pancreatic dysfunction, or you're not producing enough digestive enzymes and acid to break down your food, that food can become a toxin. Too much worry and stress is toxic to the body. So that's why we need outlets, how to deal with stress, right? We talked about meditation, we talk about praying, we talk about chiropractic adjustments, we talk about massage therapy, stretching, positive affirmations are all good way of dealing with it. And then emotional neglect. People who felt neglected, especially if they were abused in childhood, people who have been sexually abused, all these things, you could be married and you're not happy and you just, well, I'm holding on to it. That these are all things that produce toxicity in your body. Stress hormone goes up, you age, right? Any questions about that? I'll open up just for a second about the different types of toxins that we are exposed to every day. So you see there's a bunch of stuff outside and inside our body. Anybody have a question about toxins, what they are?
One quick question. When you were talking about the metabolic reactions, sometimes you may have flatulence that smells like sulfur. Is that from toxins?
Sure. I mean, the digestion of food, you're going to produce free radicals. But sulfur, is a byproduct too of some of the food's digestion. Some of the amino acids that we utilize for energy and for building protein in our body have sulfur in it. But if you get too gassy, it's always because of bacterial overload. You have bad bacteria in the gut that's taking your food, metabolizing it, and producing methane gas. And you just don't want to light a match around or something like that. You blow yourself. But no, that's why it's important to have a good gut function and good flora, right? Yeah, out on your YouTube site. Okay, yeah. So all the lectures are now on YouTube. So you guys can just easily get on YouTube. Just type in my name, and you should see the channel. All right. So these are free radicals. I want you guys to know, they're highly charged oxygen species, right? So anytime we're eating, breathing, walking, talking, whatever we're doing, we're producing free radicals. And that's why our diet is so important, that we have enough antioxidants and that our liver is not overwhelmed so that it can create these antioxidants. Primarily glutathione is made in our bodies to neutralize and put the fire out. Okay, this is just a diagram showing that. Okay, so now we're still in a COVID pandemic. And, your immune system is so important to fight it off. We have over 1 million people who have died from COVID since 2020 in the US alone. Worldwide, it's about 3 million people worldwide. But we had a lot. It was really bad in New York for a while there, and then California. And we had our share here in Georgia, but nothing like those other two cities. But it's been this ongoing. And, the people who are more likely to perish from COVID or even the flu are people who have comorbidities, right? One of the biggest comorbidity, you guys know, is obesity, because that impacts almost every system in the body, from your lungs to your endocrine system with diabetes, to the adrenergic system, to, with hypertension, and then heart disease. So high cholesterol, all of that. So we are doing something, we're learning in this 12 weeks program that we need to try to achieve our ideal weight, or a weight that doesn't breed disease. So COVID and influenza has a lot of symptoms together. We just got out of the flu season, but COVID doesn't have a season, right? It's here. And we're still doing COVID tests every day in our office, because people come in with symptoms, and we want to make sure. But you have to build up yourself inside. Your immune system has to be at the peak performance so that you don't perish from this condition, right? We know we have the shots, and people, they're up to like 4 different boosters now. And it doesn't really stop you from getting COVID. If you're going to get it, you're going to get it. I mean, it'll reduce the symptoms, but you can get it again, because the virus is smart, just like influenza is smart. We always have to get a new shot every year to combat the new strains that are coming out. The virus don't want to die. It wants to keep having a host. So it goes into people, and then it gets spread from people to people. Right. So these are some of the symptoms. You guys probably know them all. There's fever, cough, shortness of breath, tiredness, sore throat, runny nose, muscle aches. Very similar. So flu, it's different than a cold, and usually they have all of these symptoms that we mentioned. So it's not just a cold, which is just a runny nose and maybe a cough. Usually you have muscle and body aches with it. So you can tell that it's more than just a cold. And then the extreme tiredness that you get. Some people can get GI symptoms, vomiting and diarrhea. COVID, on the other hand, has all those symptoms too, but the blue tells you usually influenza don't give you a loss of taste or smell, but COVID tends to do that when you have it. You just can't, you don't smell things anymore and your taste buds are off. So it can happen 2 days after exposure, up to 14 days after exposure to someone that has COVID, right? So we're going to talk about how we can improve our immune system with IV nutrition and obviously oral nutrition as well. But the liver is the primary detoxification organ in the body. And there's 2 phases that the liver does. You don't have to memorize any of these. Just know that your liver is there for a purpose. Anything you put in your body that you take in through your mouth has to pass through the liver. It gets absorbed through the small intestines and it goes into the liver. The liver is the one who has to get rid of every medication you take, every toxin that your body comes across. If it goes in through your body, it's got to pass through the liver, unless you're injecting it, right? If you're injecting it, you're bypassing it's called the first pass effect. You're bypassing the liver. So that's why IV nutrition is so important, because it doesn't tax the liver. You're bypassing the liver. So the liver has all these things. It's 2 phases of detoxification, phase 1 and phase 2. One is called these oxidation pathways, and then the second pathway is more of a sulfation pathway, where they add different things to the chemical to make it water soluble. And then when it's water soluble, we can excrete it in the urine or the bile or the stool. If it's fat soluble, it's going to stay in your body, right? That's where all the toxins hide out. So we have to change it so we can get rid of it. And that's what the liver does with the help of amino acids and vitamins. So typically, when you do the core restore, we tell you to fast for 2 days. And some people say, 2 days? I can't fast for 2 days. But it's not hard. Because if you're eating, remember I tell you, if you put gas in the car, you're producing energy. And then you have, when the energy is produced, you have exhaust. So when you're fasting, you're not putting in energy. So the body says, okay, let me use the stored energy that I have to heal the body. So that's why it's so important to fast, so that the body is not working on new stuff that you're giving it. It's working on old stuff, right? So fasting is very important. So it encourages the gastrointestinal system to rest, and then it can utilize the stored energy to heal you, to get rid of toxins. Okay, so let's get to the crux of the talk today, which is to look at which IV nutrition, which one is going to help to boost your immunity and fight against chronic fatigue. You know, a lot of us are just chronically tired, and it's because we're not taking in the proper nutrients. So let me stop there and see if there's any questions on detoxification, and then COVID, I'm going to get into what you need to take to improve your immune system. Any questions? All right. You guys are paying attention?
Yes, paying attention, no questions.
Yes, sir.
Okay. All right. So we have these nutrients that you guys have heard me talk. I mentioned a few of them before throughout our 7 weeks so far, but I just want to emphasize some of these and how important they are for us to do. And I recommend that everyone should get IV nutritional therapy at least once a year. You know, glutathione is made in the liver. But as I've showed you that the liver can get overwhelmed with the environmental toxins, the things that we call exogenous, things that are outside of us, and the stuff that's going on in our bodies, the medications we're taking, the stress that we're experiencing. So taking glutathione, I recommend one IV push injection. It takes about 20 minutes, 6 weeks in a row. That'll last you, it'll just basically shut down all those free radicals that are in your body and help the body to get rid of heavy metal toxicity and all of that. So glutathione is my first option. Phosphatidylcholine and deoxycholic acid, you don't have to say the word, but phosphatidylcholine, these are nutrients that are in the body. Everything I'm going to talk about, nothing is foreign to the body, so there's no side effects. Phosphatidylcholine is a phospholipid. It's in the cell membrane, the lining of every cell. It helps to move cholesterol out of the body and get it metabolized up. So it's good for heart disease, high cholesterol. It's good for brain function, people with dementia and memory loss, because the fact that with people who have memory issues, could be a hormonal, loss of estrogen obviously causes some memory issues and loss of testosterone as you get older. But this helps with the impulses of the brain, because the lining, impulses travel along the nerve lining, and this helps to restore the nerve lining, so it improves memory. Our brain is the best computer out there, so anything that's going to improve the impulses is going to improve your memory. So heart disease, cardiovascular disease, brain disease, phosphatidylcholine. Myers, what is Myers? Myers is a B vitamin cocktail. When you take in sugar or you take in fat, fat can convert into a glucose molecule, which goes through the cell. The cell produces energy. You cannot produce energy from sugar without B vitamins. All along the chain, from the glycolysis pathway and the electron transport pathway, big words, but that's what produces energy. There's enzymatic reactions that's going on. You're taking the sugar and you turn it again into energy. You're taking the fat and you turn it into energy. You need B vitamins to produce energy. Okay, so just remember that B vitamin. That's why people do Myers, because they want energy. They're chronically fatigued, so they give me some B vitamins. So some of them are B12, thiamine, right? Niacin. These are all B vitamins. Pyridoxine is a B vitamin. B6, pantothenic acid, that's a B vitamin. Biotin is a B vitamin. That helps, people talk about biotin for hair growth, but these vitamins are all important for energy production, and you guys need to understand that. So Myers, I recommend 6 treatment of Myers for people with chronic fatigue, people who are just chronically fatigued or acutely fatigued, for athletes, people who've just been through a stressful situation and they're feeling down about it. Nice B vitamin boost is what you need. And then NAD, we talked about it more, but nicotinic adenosine dinucleotide is what it is. It is the new anti-aging formula because it drives the energy pathway, and it's in every cell of the body. All right, many of you guys are doing the fat burner, or they call it the skinny shot, right? So it's 3 amino acids, carnitine. So you have B1, which is thiamine, and then B5, and then you have methionine, inositol, choline, thiamine, and pantothenic acid, B5. So there's a lot of stuff, different concoctions of fat burner. vitamins. We have B12 in ours and Mic. And this is cyanocobalamin, that's B12 or hydroxycobalamin. Some people believe hydroxycobalamin is better than the cyano, because cyanocobalamin is really with cyanide, right? So, but small traces of cyanide don't hurt you. That's why they allow you to use it. Excessive amount will kill you. All right, next slide. So we get into a little bit more. So glutathione is so simple. It's 3 amino acid, and they have to have these 3: cysteine, glycine, glutamine. It helps. It acts like fly paper. You know those little things that we used to hang in our house back in the 80s or 90s when we had flies, and the fly would come around and stick on it. Picture glutathione like that. The fly is a toxin. So glutathione is there in the blood. It's waiting. It sees the toxin. The toxin comes up to it, it sticks it, and then whoop, it's gone. Right? So it neutralizes the free radicals. So, and we know why free radicals are harmful, because they damage your cell. Right? So it's like the exhaust from the gas is still in your body, banging around, creating havoc. So we want to neutralize it. And that's when, if our liver is overwhelmed and we're not producing enough glutathione, which it often is in our environment, we take glutathione and it neutralizes it. You know, they call that whole thing oxidative stress. It's a big chemical word, but that's exactly what happens when we don't have enough glutathione to neutralize those free radicals. So once a year, at least, come and get 6 treatments in a row, put the fire out and go about your business. So where's glutathione found in food? The best foods to eat are cruciferous vegetables. They have everything. So you talk about garlic and onions and broccoli, cauliflower, Brussels sprouts. One of my patients told me yesterday, it was a patient or a provider, we were talking about, it was a provider. She said, do you know that broccoli and cauliflower, even though we have all these benefits from them, it's written in books, all the benefits of broccoli and cauliflower and all this, but that they are genetically modified, that they weren't naturally occurring. Their genetic engineering is what produced those, but they're here to stay. I don't think they're going to stop making broccoli and cauliflower, right? But you get it from that. Glutathione is in it. It detoxifies the body, and it's great for fatigue. Reduces inflammation in the body, and it helps with regulating your gut bacterial function. 6 weekly pushes. Yeah, I have here every 3 months, but even if you do it once a year, you're good. All right. Any questions about glutathione? The most powerful antioxidant in the body. Anybody listening?
And taking notes, Doc.
Yeah,
Mm-hmm.
I just had a comment
Yes,
about the
sir.
healthcare
Yes.
provider, Doc.
Yes.
Yeah.
To say that it's GMO'd is a stretch. Selective breeding is how we came about those cruciferous vegetables from mustard greens, and it was done by monks maybe about 100 or so years ago. So selective breeding and genetic modification are vastly different. So
Okay.
they're not
I'll take that because I love my broccoli.
it's selectively breeded.
Yeah. Yeah, you just, you know, when it happened that long ago, you don't even know, right? Unless somebody brings it up and says, yeah, well, if you look it up, you'll see.
Right.
Right? So those are
Like
some.
they want to say it's modern, GMO. Kind of not the same.
Yeah, that makes sense. That does. Okay, we talked a little bit more about Myers. It's great for the B vitamin I told you about. It's awesome. If you have fibromyalgia, it's good for that. It's good for anxiety. It's good for IBS. It's good for adrenal fatigue. These are stressed out people. And autoimmune disease. It helps with your allergies. And it's good for heart disease. So there's so many things that you can use these B vitamins for, because the bottom line is that it increases energy and improves your emotional state. So the magnesium in the Myers is what typically helps with patients who have headaches, migraines in particular, and fibromyalgia. And here's what's in the Myers. I talked about the B vitamins. This is a B vitamin, this. So we have a B complex, which kind of gives you everything, but then you have extra pyridoxine, extra B12, and extra dexpanthethol or pantothenic acid. Then you have these minerals. You have magnesium and calcium in there, and you have vitamin C. Obviously, it's not high dose vitamin C, but vitamin C is also one of the body's most important antioxidants. It's not as strong as glutathione because it's just vitamin C by itself, but with high dose, you can reach the potency of glutathione. And we mix it with some saline, and then we put it in an IV and administer it over an hour. So you do need some time when you come and you relax. You can't be on a clock. All right, so that's Myers and phosphatidylcholine. I mentioned before that it helps with cholesterol and triglycerides. People with heart disease need to be on this. People with memory loss needs to be on this. And I recommend 10 treatments of this. It helps with detoxification as well, and because it goes into where the fat is and it pulls things out, all those things that go and hide out in the fat of the body. So here are the indications. If you have heart disease, if you have neck, blockages in your neck, blockages in your leg, if you have dementia, right? We all know that dementia is when parts of the brain don't get adequate blood flow and it dies out. The substantia nigra and different parts that's responsible for cognitive function and memory. So the phosphatidylcholine will help with the impulses in the brain. It helps with diabetes, especially the blood vessel damage from diabetes. And if you've had angioplasty, they recommend taking some phosphatidylcholine to get rid of some of that dye. It lowers the LDL cholesterol, and it helps with homocysteine. It helps with degeneration of the retina, so visual problems, memory problems, cognitive deficits. Yeah, you can't beat this. It's a fat soluble. It's in every cell membrane, and all you're doing is just pushing the ratio over to a positive amount without the body having to make it. You're just giving it more, right? NAD. I talked about NAD. It is a miracle molecule, right? So a fuel your body needs to function. So it is in all living cells, because everything that I'm talking about today are natural compounds with zero side effects. We know what it does, so we give you more of it in the form of an IV. So your body doesn't have to work to get it. It goes right into the vein, right to the targets where it's needed. So it's been shown to help with your DNA damage from free radical damage. It protects the brain, it wards off dementia. So that's why it's considered anti-aging, because it's wonderful for that, right? It helps your thinking function, your cognitive function. And it helps with impulsive behavior. Some people use it for people who have ADHD. They use it for all forms of impulsive behavior and addictions. I say it's the best anti-aging molecule because it's been shown to help your genes revert to a better functioning state. All right. And here are the things. You can do it in an IV over 2 hours. You can do it over 3 hours more, you get more milligrams, or you can just get a shot. The shot is the cheapest. And this is what we do typically. We've had people to do the IV, but most people just come and get a shot in and out, and they're gone. It helps with weight loss. NAD. That's all you have to remember. You don't have to know the long name. Vitamin C. Pasteur, the great scientist, he was the one who was big on vitamin C and why it's so good. It's an antioxidant, we know that. So it does bind free radicals. And the more you have is the better. It helps with your immune system because it's reducing free radical burdens and inflammation. We do not make vitamin C, so we have to take it in our body. We get it from fruits and vegetables. It's not in meat products. It's in fruits and vegetables. Many people were using vitamin C, high doses, 50 grams, 75 grams, 100, 150 grams when they got SARS or COVID. These patients would be on their deathbed and they would give them these high doses of vitamin C. It would help with that cytokine storm that, most people die of pneumonia from adult respiratory distress syndrome, where the lungs collapse from the inflammation from the virus. The virus causes this release of inflammatory mediators in the lung, collapsing the lungs. You cannot oxygenate, and that's why most people die from COVID, from cardiopulmonary failure. So using vitamin C, they've found that the cytokine storm has been ameliorated or reduced. I could tell you all the people who came in here scared during the peak of the pandemic because they had just been diagnosed with COVID and they wanted vitamin C. So we would just put them in the back, hook them up, start them out with 50 grams. They would come for, they would get 3 treatments, and none of them, I didn't have anybody who died from COVID who had vitamin C. Even people who are diabetics and overweight. Some hospitals were doing it, the progressive hospitals. Most of the hospitals just gave you steroids, which suppress your immune system even more. But it suppresses inflammation. And, they found that if you use vitamin C, these people did much better. And there was lots of papers being published about it. So yeah, it helps to, obviously, we use it a lot in cancer as well, because it helps to kill cancer cells. It increases hydrogen peroxide, which is a base in the white blood cell. And so the white blood cell can then go to the cancer cell and it can help to kill the cancer cells, not normal cells. That's the beauty about vitamin C when we use it as an adjuvant. We don't tell people don't take your chemo, don't do your thing. But if you want nutrition for your body, to help your body to fight the cancer, you should come and get your vitamin C IVs. So we've had lots of people who've come in, unfortunately, a lot of people come after chemo has failed and they're stage 4 and they just want to buy time, and vitamin C is good for that. It'll help to give them more time. But if they'd started early in their cancer process, it can definitely help to cure them. So it says it arrests the growth of the tumor cell. It promotes lysis, which is breakage of those cancer cell, and death of the cell. Regular old vitamin C, but high dose, high dose. Normally, you're taking 500 milligrams or 1 gram. I'm talking 50 grams, 100 grams. So you just flood the blood with it. And it's infused over 2 to 3 hours, and it does help. Okay. So now let's talk about some of the most important minerals. Zinc. Zinc is very important for the immune system. It helps with the viruses, right? It helps to halt viruses. It helps to break up the viruses. Don't have nucleuses, right? They don't have a center like every cell does. It's just protein and DNA. So what the zinc does, it helps. Cytotoxicity means that it helps to break up those cells. So when people are sick, they have a common cold, they take zinc, right? Zinc lozenges. It has efficacy against viruses. So we always recommend zinc if you should get any virus, including COVID. Okay. You don't want to be deficient in zinc, so you should take it. And we recommend between 20 and 50 milligrams per day. And yeah, they're doing more studies. Selenium is another trace mineral that helps to, it's an antioxidant. So we have several metals that are antioxidant that are good for the body, right? Not lead, not mercury, but zinc, selenium are the two good ones, right? So they used selenium in COVID, and that they were able to see that selenium helped to reduce the symptoms of COVID infection. They don't really know how it works, but they know that because it's an antioxidant, it may just help in that way. So when patients had COVID, we would put them on vitamin C, we'd put them on zinc and selenium. Vitamin D, my favorite vitamin. It's fat soluble, so it can get into the fats. It's important for your blood pressure, your blood sugar, your immune system, and your bones. That's all you have to remember. You don't want to walk around with a low vitamin D. You have more people now with low vitamin D and getting sick because they don't have enough vitamin D to upregulate their immunity. And people with low vitamin D, they get more cancers, they get more infections. You got to get your level up to not 30 that they recommend, but 60, 70, 80, 90. Try to keep it under 100, but between 60 and 100 is where the vitamin D efficacy or effectiveness has been shown. All right, so people, we're not getting out, we're not getting the sunlight. When you do get the sunlight, remember that it has part of vitamin D, and the second part is made in the kidney. So there's a two-step process to making vitamin D. So if you took the vitamin D, you're helping your body out, and you're not putting extra load on your body to make the activated form of vitamin D. So
Dr. Christie, can you backtrack to when you were saying when you're out in the sun? Because it kind of broke up.
Okay, yeah, it said it popped up that my internet was a little slow there. So vitamin D is made, when you go in the sun, the phototherapy of the sun activates LDL cholesterol. And then when it does that, it then passes through the liver. The liver does something to it. Then it goes to the kidney. The kidney does something to it to get active vitamin D. So being in the sun, you need to still have a good liver and a good kidney to make the effective form of vitamin D. So people say, I'm not getting enough sunlight. You're right. You're not getting enough sunlight because we're all working indoors. We're not out there tilling the soil anymore, right? So it's always good if you know you have a normal liver and kidneys, which most of us do, unless we have, a chronic disease, then you will make vitamin D by getting sunlight. What food you can eat to help with vitamin D? Does anybody know? Where do you get vitamin D from? And don't tell me milk, please. That's what everybody thinks. Oh, I'll just drink a glass of milk. Fish, oily fish. You get vitamin D from oily fish, sardines, salmon, tuna, herring, all sources of vitamin D, the highest food source of vitamin D. If you don't like fish, then do what everybody else does. Take at least 10,000 IUs a day orally. It'll get absorbed, and you can keep your level up above 60 to prevent cancer and infections. Okay, I want to emphasize how important vitamin D is. So all the things that I talked about, those nutrients, zinc, selenium, vitamin C, vitamin D, we should be taking them, especially in this toxic environment that we have. And then once or twice a year, you should come and get your glutathione, your IV vitamin C, or any of the other IV cocktails, because it's only helping your body. Especially if you've had a challenging year or a few months, you just want to detoxify yourself. All right, so you messed up, and you have Mimi.
Yes, sir. I didn't want to interrupt, but I just purchased your women's daily vitamins, 50 plus, trying to get the most out of it. With those vitamins, also I got the PEM, but are those nutrients, the vitamin C, zinc, selenium, vitamin D, is there a adequate amount in those vitamins, or would you suggest?
Yeah, they have a good amount in there. I do recommend taking extra D and extra C. There's selenium in there too. There's zinc in there. It's a multi. But those two particular vitamins, you can never, vitamin D is fat soluble. So, once you get your level up, you're good. It's not going to go away quickly. Vitamin C is a daily thing. Because it's water soluble, it just flushes in. It's in your body for probably 6 to 8 hours, and then you're peeing the byproducts out. Water soluble vitamins, like the B vitamins and vitamin C, they're water soluble. They don't stay long. They go in the body, exert its effect, and then they're excreted. Fat soluble vitamins stay longer. Vitamin D is fat soluble. Vitamin E is fat soluble. Right? Vitamin A is fat soluble. So we in medical school, we used to remember ADEK, A, D, E, and K, all fat soluble. So they stay longer, and you have to be careful with your supplementation. As I told you, even with D, you don't want to go over 100, in terms of your level, but you certainly don't want to be below 60. And most people that we check in a routine, they're under 20. Okay. Hopefully that answered your question.
Absolutely. Extra C and D. Thank you.
Chelation therapy. Now, this is pretty big when I first started in integrative medicine. And I think it's coming back because of a TAC2 study, a study National Institute of Health conducted it through Duke University. And what they did was they had diabetics that had a heart attack. That's who they focused on. Because we know diabetics are prone to heart attacks because they had high cholesterol and the high sugar, and usually the pressure, everything kind of forms these clots and hardening of the arteries. So they put one group, they gave them chelation therapy, which is using this chemical called EDTA. It's a chelating agent. And then the other group, they just gave them vitamins. The chelation group had vitamins too. So the difference is that everybody thought they were getting chelation, but the blinded group, the one, you don't know what you're getting. Are you getting the chelation or are you getting saline? And they followed these people out. And the group that was getting the chelation there was a 70% reduction in a second heart attack versus the group that just got the saline. So now the final report, we participated in the study. I had 3 people that we did, and that data has been processed. But they had to do 40 sessions of chelation and over a year, and then they're being followed, right? So these studies, they don't occur overnight. It's a process. But all the results thus far are showing a 70% reduction in cardiovascular in a recurrent heart attack. And for people who just have, let's say, unstable angina, they didn't have a heart attack, they're finding that the plaques are being removed with this EDTA chelation. So if you know you have, say you go into your cardiologist and he says you have calcified plaques, but you didn't get a heart attack yet, this is what you need, because it can actually, it's been shown to remove the heavy metal like cadmium from the plaque. Then when the cadmium is removed, the plaque becomes soft and it dissipates. So this is going to be, once the final study comes out, this is going to be endorsed by the government for people with coronary artery disease or cardiovascular disease. It's also good for people who have bleeding ulcers or diabetic ulcers because of poor circulation. Just picture something, a chemical that's just goes and it's just picking out the metals and calcium is a metal. So it's removing these metals and reducing the plaque burden, improving circulation to the area, whether it be the heart, whether it be the leg, whether it be the brain. Chelation therapy. We've been doing chelation in our practice for probably 7 years. We don't get a lot of patients doing it because people just can't afford it. We did more of it when we were involved in the study because that was paid by NIH. So, we just had to get the candidates, people who had heart disease, and treated them. And then we were paid. Actually, they sent us the chelation. They sent us everything that we needed to participate. But I've had several people to do it on their own. The therapies cost $200 per infusion. So if you figure you need at least 10 treatments, so that would be 10 times, that's $2,000. Well, what's the cost of a heart attack? That's a trick question. So here's how it works. These are actual slides, right? This is a patient before chelation. You can see the narrowing of the blood vessel. This is after chelation, 6 months later. Look how much open the artery is. This is a leg artery. This is a carotid artery, neck. That's carotid. And this is iliofemoral artery. And this is from the actual study. They did these scans. Look at this one, before chelation, after chelation. It opens up the artery. So, if you don't want to have a heart attack, you already have hardening of the arteries and narrowing of the arteries. the next thing you do is going to have a heart attack or a stroke, or you're going to lose a leg, this is a good choice. And it's not covered now by insurance, but I predict in the next 3 to 5 years, it will be covered. You know, you can get the Roto-Rooter, where they go in and they put a stent in and open up the artery and then run the risk of a thrombus or a clot, or you can remove the plaques with a chelating agent and move on with your life. You know, obviously there's changes that you have to make in your lifestyle, because lifestyle changes trumps treatment any day. So here are the takeaways. We need detox because we live in a toxic environment. I recommend the core, and most of you guys who are in this program should have started the core the first week. I recommend IV detoxification at any time. Glutathione, phosphatidylcholine, NAD, Myers, excellent for fighting detoxification and fighting fatigue and autoimmune disease. You need your immunity revved up. You need C, D, selenium, zinc, and other B vitamins. Then chelation therapy has been shown to remove cadmium, a metal that causes hardening of the arteries. And those are the prices of the treatments. They're not expensive, but they're not cheap. So that's what they are. And it's 2 o'clock. All right, so we have Dion. I'm going to give you guys one last opportunity to ask questions. So any questions or comments?
My comment is, yesterday I went over the first few videos that you started, and I weighed myself in after a colonic. I weigh 148, feeling great. So I'm listening to the keto diet and everything that goes into it, which is great. I've been eating broccoli the last 2 days, but I don't need to lose 30 or 40 pounds because then I'll be anorexic. So
Why would you be anorexic?
Because if I lose 30 pounds, I'll be.
You mean you'd be skinny? Anorexic is not what you would be. Anorexic is a mental condition, anorexia nervosa, where you're vomiting your food that you eat. No, you're not gonna be anorexic. You'll be skinny or slim, right?
Yeah. Sorry, I'm a Southerner. After we get past 120, they call it anorexic down here in the South. So my question would be, because as I'm listening to the fasting for 2 days, changing what we're eating, writing down what we're eating, what diet would you suggest for someone who feels like they're already at an ideal weight?
The natural carbohydrate program is great for this regular routine eating. It's in the book too. You can have healthy starches, like potatoes, like beans. You can have those. You're not going to lose a lot of weight when you eat those, but it's healthy. Those are natural things. I still recommend limiting any things like flour products, because flour turns into sugar. And there's so many things made from flour, right? And grains. You have your breads, your cakes, your cookies, your crackers, your biscuits, your croissants, your pizza, your pasta. I mean, I just named 8 things off the bat, and all made from flour.
The bleached.
Right? Yeah.
Yeah.
And even whole grain. I mean, whole grain is better, obviously, because you have more fiber and more minerals and nutrients in it. But it's still going to break down into sugar at a slower pace, which has to do with the glycemic index. So white flour products should just stay away from it. And
you have a digital copy of that book, correct?
Yeah, and I thought Stephanie said she sent it to you.
I didn't see it before I jumped on this session today, so I'll definitely check once I log off the session to see if it's in my inbox.
No problem. But thanks. I really appreciate your questions. You keep everything going. You ask enough questions for a lot of these folks who are too shy to talk. But I totally enjoy having you on here. Any other questions? Dr. Ward, any final comments?
No final comment. Just that even in the natural carb, there are some great alternatives to wheat flour, there's almond flour, there's
Mhm.
cauliflower flour. I mean, there's just a myriad of things to have a low carbohydrate, but an anti-inflammatory lifestyle,
Diet,
right?
yeah.
It's not, wellness is, it's a portion of weight, but it's, so many other things.
All right, so we've just completed week 7. We have 5 more weeks to go. I want to thank you guys. This will be available in YouTube and probably by tomorrow. So we'll send out the link then. I'm just not going to send out the Zoom link anymore. I'm just going to make sure, get my IT guy to get it and process it and put it on YouTube. So this way it's more accessible. Okay? Y'all,
thank
hear
you.
that
Thank
let me
you.
hear that country, that southern drawl, Mimi. Say y'all.
Thank y'all. I really appreciate it. And
All
merci beaucoup, monsieur. Y, muchas
All right.
gracias, señor.
right. Roots. Bye.
All right. Bye-bye.